Thank you so much for doing this with us and being here today. I have a few questions about how you've been and how all of these struggles started for you. So when were you diagnosed with depression or bipolar affective disorder?
So I was diagnosed with depression at the age of 15, 16. Started to take medication for depression in my 20s. And then 6 years ago, I was diagnosed with bipolar and advised that I'd been misdiagnosed 25 years ago.
What kind of treatments have you been offered so far?
So I've had talk therapies with psychologists, therapists, counsellors. I've had several different oral medications as well, up until I've come to see you.
Was the medication for depression useful for you?
It was quite difficult on the tablets to function. So you'd have really low moods where you can't get out of bed. You'd feel numb sometimes from the tablets as well. So you just didn't feel anything at all. And I found that really difficult because I had a child. And to feel nothing when you've got a child is really difficult. But I never felt like the tablets were making me better. I felt that they were suppressing my moods and not actually improving my quality of life.
And did you have any side effects?
Yes, I was really sleepy. Appetite would go as well, so I wouldn't eat much. Social skills, didn't really want to socialise or talk to anyone. I've had a couple of tablets where I've actually felt worse rather than better. But yeah, oral medication I haven't been able to even out my mood on oral medication.
And how did the illness impact your life in general, so your work and home?
So over the last 6 years, I've practically been housebound, leaving the house maybe once a week to do a food shop. I have to psych myself up for that like 3 days prior to leaving the house. Due to that, I wasn't going into the office for work because I couldn't leave the house. Socialising went out the window, losing friends because I wasn't meeting up with them, talking on the phone, texting. There was no communication. I was just in the house by myself, really.
What about childcare? Because it sounds quite difficult with what you're saying.
I think I felt so bad because I thought that I wasn't being, as a single parent, I wasn't being a good mother to my child. I wasn't meeting her needs. So I think that fed back into how I was feeling as well. It was really difficult, but I had to try and push through for her. And I think she was the driving force for me.
How did you find out about rTMS, repetitive transcranial magnetic stimulation?
So I'd never heard of it until I became a patient of yours. And at first, when I heard about it, I thought it was the old electric shock that they used to do on people with mental health diseases. So I got to researching straight away. And I found that not many people in the UK, well, I couldn't find anyone in the UK that had documented anything regarding this treatment. So without you explaining it to me and introducing me to it, I would never have known about it.
So how many sessions have you had and how did you find the sessions themselves?
So first round that we had, I had 30 sessions and they were all back to back over 2 3 weeks. At first I was just getting used to how it felt. It's a bit, you get a bit nervous because you don't know how it's going to feel. To be honest, I was quite surprised. It wasn't it was a bit uncomfortable, but it wasn't painful. And it was just getting used to that sensation of the tapping on your head. I think the treatment itself, I think when I was halfway through it, I think because all the feelings that I'd been feeling with the depression side of my bipolar, that was starting to lift, and things that I had been suppressing were coming to the surface. So I found that hard because it was new to me. I was now in a position to deal with those things that I'd been suppressing. So halfway through, I'd say it was difficult, but not the treatment itself, but the way I was feeling and the things that I had to deal with during that period of time.
Now it's weird, even in this video I can see the difference. I'm smiling.
Yeah.
The first one I looked like I was in black and white, like I was grey and miserable, and now.
Yeah.
Whereas before I wouldn't. Like when I looked in the mirror this morning, I don't like looking in the mirror. I haven't like my entire life. I looked in the mirror this morning and I felt like I looked healthier.
Yeah.
It's quite crazy.
It's wonderful, isn't it?
Yeah.
So now, after 3 months, that was 3 months ago, I've now come back for a top-up of 8 sessions, and I've got 1 more remaining today, and then hopefully I should be good for about 6 months.
We talked about various aspects of your life earlier when you were ill. How has life changed with regards to all of those, work, childcare? Obviously, your children are grown up now.
Yes.
Home management, socializing aspects and all of those things.
Everything's changed. The biggest thing for me, and I'm still in shock, is when I leave my house and I go and sit in my car and I think that was so easy. I didn't think about it the night before. I wasn't stressing about it in the morning. I just got up, got dressed, and I'm in the car and out the house. That has been the biggest, I think that was the first thing I noticed. And then after that, my mood has changed. Before I felt like I couldn't do things, or I felt like I was tethered to my bed and stuff, and now I've got a routine. I'm up and out. Sleep was a big thing for me because I had insomnia from the age of about 12, and it was really difficult sleeping. And now for the first time, it feels like in my life, I've got a sleep pattern. I sleep 12, I'm up at 6 every day. And I think that has changed so much in my day-to-day life as well. I feel like I'm in a better position to handle day-to-day life. I'm now starting to socialise, which I haven't done in 20 odd years properly. So I'm reconnecting with friends and family, and being able to do activities with them and explore Birmingham and beyond has been amazing.
Wonderful. Thank you so much for coming in and explaining all of this. I'm sure it wouldn't have been very easy for you. So thanks a lot. I'm sure your story is going to help a lot of people through their difficulties.
I really hope it does, because it's been life-changing for me. So I hope that it will help so many more people.
Thank you.